Waiting as the folks. Good afternoon or good morning, wherever you may be. Welcome to the CORD RQMO webinar on the rare disease drug strategies, or I should say as well, the rare disease strategies that are underway. And I would say, and I'm going to pass it over very shortly to our presenters, you'll see that there's so much happening across the country, out of Ottawa and in the provinces that we're going to share with you today. And this is, the first time in a long time that we've seen this, and we're going to be doing it in French as well at 1 p.m. So if you have colleagues that want to get this webinar in about an hour in French, please invite them. Introducing our panelists, we've got Dr. Durhan Wong-Rieger, the President and CEO of the Canadian Organization for Rare Disorders. And we've got Dr. Jonathan Pratt, who leads the Regroupement Québécois des Maladies Orphelines in Quebec. And we are going to walk through exactly what is happening in the world of rare disease drug strategies. So with that, I'm going to pass it over first to Durhan, and then to Jonathan, who's going to explain what's happening in Quebec. And then we're going to hopefully have time for some Q's and A's. If we don't, please use the chat function of the webinar to provide your comments and your questions. We'll collect them and we'll get back to you offline. And as Durhan's going to say, this is not the only time you're going to have a chance to interact. But over to you, Durhan, to start walking through. I'll control the slides.
Thank you very much. And I am so delighted to be here with Jonathan from RQMO. It's been a long time, I think, since we've been able to do something together. And this is actually a brilliant opportunity to do something to talk about rare disease strategies moving forward. So thanks a lot, Bill, for hosting this as well. And just to say as well, if you have comments or questions, put them into the chat as we go along. And if there's something that we can bring up during the talk, we'll do that. But it's a very short time that we're presenting. But I'm going to say right up front, we're going to present a really high-level overview of where we are with regard to the federal and provincial strategies that are there now, but also let you know that there will be ongoing series of consultations and live events that will be taking place throughout the rest of this year. And some of them we hope very much will be together with the Quebec group. So really stay tuned, and really thank you very much also for people's interest. So next slide. This is just CORD. Hopefully all of you do know us by now and know that we are in fact a bottom-up patient-driven organization, and really our mandate is to improve the rare disease policy scene, but also improve services and support for patients. Next.
Yeah, so it's my turn already, Duran. So thank you, Bill, for the presentation. So yeah, like Bill said, I'm Jonathan Pratt. I'm the Executive Director for the RQMO since July 2022. And at RQMO, we have 33 different associations of patients that are members of RQMO. So we're mainly providing services by our iRare Center, which is a center that gives information and support for all the patients that have a rare disease in Quebec. Our mission is approximately the same as CORD. So we want to raise the awareness on rare disease, acting directly to raise the awareness across the population, and also specifically working on training, also developing tools to help clinicians to better treat and diagnose patients. So I'm really happy to be with you today and doing this with Duran. It's been a long time we were talking about that. So I hope you will find some highlights really important today. And don't hesitate, if you have any questions, we'll be there at the end to respond to them.
So next slide, I'm going to jump back into what I'm going to open with is an overview of how we got to the federal rare disease drug strategy. our comments around what CORD has proposed with regard to a rare disease strategy from the very beginning, and where we're going to be picking up going into, as we say, the rest of this year into the future as well, for a rare disease strategy to parallel, to wrap around the proposed federal drug strategy, and hopefully to be really working in coordination, collaboration with the Quebec rare disease strategy. So I think you'll find some tremendous synergy here. And I think our efforts at each one of our, from our associations, but at each one of our levels, are really going to help us propel rare diseases in Canada. So this, I think, was just the beginning. I don't need to belabor this. I think many of us already know this. Is one of the impetus for the government's drug strategy, and certainly one of the challenges for all of us is the fact that getting access to drugs for rare diseases, as for drugs for all diseases, is a multi-step process, starting with before clinical trials, many different agencies, including the PMPRB, including our health assessment, CADTH and INES, including the joint negotiation group, the Pan-Canadian Pharmaceutical Alliance, but beyond that, then needing to still get agreements from each one of the provincial drug plans to make these drugs available. Not only is it time consuming, it leads to very uneven access, even though some of the steps are done together. So our impact, as we say here, as we all know, is that patients are either not getting access or they get extremely delayed access. Next slide there. The other thing that having this cumbersome multi-step process is that it is a disincentive for companies to bring their drugs in, certainly to bring them in a timely fashion, but also a disincentive for them to even just bring the drugs into Canada when they are already highly challenged in terms of small patient population. So this is just an overview of looking at, and this is with the EMA, but it's even worse when we compare it to the US FDA. European drugs, 63 drugs, if they start off with the approval and an orphan designation, time to get to Canada, only 44 of those. So really, we're down to 2/3 of those drugs that are approved, usually life-saving drugs, life-supporting drugs. By the time we get the companies get to Health Canada, only 2/3 of them show up. And then we get to only half of those, less than half of that original grouping actually gets recommended by the Health Technology Assessment Agency. And as you can see here, despite the fact that Quebec can do some great things with their patient d'exception and getting individual access, when it comes to getting them onto the formulary, so it's easy access, INES actually does an even poorer job than does CADTH in terms of their recommendations. And at the end of the day, as we say, starting from the very beginning, we end up with only 24 drugs. So maybe about less than 1/3 of the drugs that would be approved in Europe actually get to our patients, and again, with much delay. Next. So this is just an overview. I don't need to belabor this. Most of us know this. This is again why we're here, is that in fact, getting drugs approved in Canada is in fact very time consuming, but only, as we say, 3 out of 5 drugs approved by the US or European regulators are actually submitted to Canada. The key point here is sometimes up to 5 years later, submitted up to 5 years later. And on top of that, then the process for assessment, the process for negotiation, the process to get into a formulary, we're adding many years. And of course, we know with rare disease patients, you don't have the time to wait. Next. So again, this is just a reiteration of it. I won't belabor it. I think this is important though, but we add another factor, and this is something that is not just Canada problem, but it is universal, and that is only a small portion of the patients that would be deemed eligible to receive a drug that is approved and even reimbursed actually gets that drug. So there's much fall off along the way for lots of reasons, including a timely diagnosis, including the right kinds of specialist prescribing and support. So when we think about, again, the tremendous impact that these drugs could have, only a fraction of the patients that are deemed eligible that could benefit from it, even with an approved drug, even with a reimbursement drug, actually get access to the drug. This is a tragedy in terms of the system, and obviously a tragedy for the patient population. Next slide. I mean, we hear over and over again that the big challenge is that these drugs are so expensive, and that, I haven't heard it real recently, but we hear it again a lot of times, and that is, the rare disease drugs are going to bankrupt the population, will bankrupt the drug plan, bankrupt the healthcare system. And what we know, of course, is that that is far, far, far from any kind of accuracy. You look at the expenditure in terms of drugs on rare diseases in 2020, when we already brought in many, many drugs. At the end of the day, what we can see is that it really is a tiny drop in the ocean of what we spend in terms of other kinds of therapies, in terms of what we spend in terms of other public health, and relative to what we spend in terms of the overall drugs public health system. And what we don't have in here, which needs to be explored, is that in many cases, these are in fact life-saving, life-altering drugs that have tremendous return on value when we think of the other kinds of costs, both in terms of not only in terms of missed quality of life and missed social impact, but also just the healthcare resources and social resources that are needed to be used for diseases that are not optimally treated. Next slide. So this is kind of where we were. Canada was very late to the game, including a direct rejection of it. We did not have a orphan drug policy. It was almost at one point. This was then the impetus to the federal government making the announcement that they did in 2019. You can see many other countries already involved in terms of supporting for the research and development of rare disease drugs, but also the access to them. Next slide. So what we know is that, and as Jonathan, will relate later, CORD and, RQMO were really, as in many countries, it was the patient organizations that drove rare orphan drug policy in the US, in Europe, patient organizations that drove the establishment of rare disease strategies. And we have, both of us, been working, to advance strategies, actually to develop strategies, to prepare blueprints for strategies, to engage other stakeholders to come and support strategies from the very beginning. 2015. So this is, almost 8 years ago when we think about it now. We tabled our first rare disease strategy, which actually had 5 pillars, right? Early detection and prevention, timely, equitable, and evidence-informed care, including the community support for other kinds of social, economic equity issues, sustainable access to drugs, and promoting research. It really hasn't wavered from then, and very much so you'll hear more from Jonathan about RQMO and what their history has been. Next slide. So this is kind of what I think most of you know. I was just at a luncheon yesterday when Minister Duclos stood up again, talked a whole lot about all kinds of investments in terms of innovative health programs, but mentioned again their huge pride in terms of the investments of $1.5 billion for the next 3 years on an orphan drug strategy. And we are in fact quite amazed in it. What we are somewhat dismayed, and I say this aloud because I've said it to the government as well, $1.4 billion of that is tied up in bilateral agreements. It means that you work with the provinces to unlock that money. And what we do have are other monies that have gone to some of the other things that we call for, to research, to advance research and development and clinical trials for rare diseases so we can get better, earlier access to these drugs coming into Canada, creating a pathway for them. Really very much an investment in data and collecting information, and then some forms of administrative advisory support. So $1.5 billion is there, but unlocking it means that we have to work with the provinces. Next slide. I'm going to provide you very high level. Again, those of you who participated with CORD over the last 3 or 4 years will know that we are proposing then a rare disease strategy based on our 2015 documents that will absolutely facilitate, but also bring value back to the investment in a drug strategy. We need to have centers of expertise. We need to do early screening, detection, diagnosis. We need to be able to provide access to specialists. We have to have, that designated pathway to getting accelerated access to drugs, getting rid of that multi-step process that brings us directly to getting access. And then we need to have, as we say, a research environment that includes clinical trials. And then we have to have patient data, patient engagement throughout. Next slide. And this is just a high level, again, opportunity to talk about we need an alternative pathway. We cannot survive using the multi-step, multi-year process that we have now for rare disease drugs. So CORD will continue to do the advocacy around this, and CORD will continue to do consultations. Stay tuned. We hope to have another webinar in a few weeks that'll bring us there, and a face-to-face meeting at the end of June. With that, I'm going to hand it over to my colleague, Jonathan, who's going to talk more about the Quebec strategy. So as you can see, just to say prelude, 2017, Ontario, using our 2015 rare disease strategy, came up with their own blueprint, and we had a working group that created it. The Life Sciences Ontario Vision paper falls in line exactly what we're talking about in terms of supporting research and development. And in our conversations with the minister's office, of which I actually had another opportunity yesterday, reiterating strong support for an Ontario strategy, but we need to make sure it comes so that we can get that $1.4 billion that's locked up in bilateral agreements out there. We need to get every province on board to do what Quebec is doing. So over to you, Jonathan.
Well, thank you, Duran. It was a really nice overview on the Canada side. On Quebec side, I just want to mention before I start that RQMO was founded in 2010, so it's been 13 years now that we exist, and I just arrived one year. So I just want to really thank our former, the founder and president of RQMO. Sorry. So I really thank Gail Willett for having this opportunity. She worked really hard in the last 20 years because she was working mainly before creating RQMO. So I'm really glad that now we have a Quebec rare disease policy that came out on June 13 of last year. So it was the beginning of something really great. So the policy was about 3 different axes. So, and it's interesting because, like Duran said in the last couple of slides about creating center of references and centers of excellence, putting money for research on rare disease and everything, Quebec thought that about the same. So the first axis was about raising awareness and training of healthcare professionals. The second one was to make sure that patients who have rare disease, they have easy and equitable access to diagnosis, care, and services. So there are a lot of different programs that will be put in place in the next few years. And also for the third axis, it's on promoting research, innovation, and data gathering. So, like I said, we can go to next slide. Sorry. Like I said, the Quebec policy came out on June 13 of last year, and on this year, so May 1st. So it was about 1 month and a half ago. The action plan, the Quebec action plan for rare disease, came out. It's a big document. It has over 50 pages, and it's really like a complete action plan that goes around the 3 different axes. So I will just point out some of the highlights because we have a short period of time, and I really want to make sure you can ask questions if you have some. So on the first axis, on raising awareness and training of healthcare professionals, it's the main aim, if I can say like that, it's to create these centers of reference to make sure that all the different clinicians that have that are specialists of something, they can talk to each other. Like we know in the rare disease world, many patients, they are working hard to have a diagnosis, and it can take to like 3, 5, 8, maybe some of them wait more than 10 years to have a diagnosis. So and why? The reason is really simple, is because the patients have to go see different kind of doctors, different clinicians, and unfortunately it's not at the same place. So they have to travel around to find them and make sure they can talk with each other, and it's not a simple task. So that's the first aim. The second one is to create what they called Navinet. It's a national clinical navigator network for rare disease. So it will give the opportunity to really make sure every healthcare professionals can talk to each other, and to make sure patients have the right services in a faster manner. Also, we are working really in conjunction with different associations to make sure we provide tools for Quebec. We have different patient associations that are working really hard at the moment, and we did a lot of things in the last couple of years to raising the awareness, and it's going to take place during the next year and in 2024. So we hope that and the exact process of how it will all comes together, it's not really known for now, but I guess we'll have some discussion in autumn, so in the fall, sorry. So we can go to next slide. In the Access 2, like I said, it's to give easy and equitable access to diagnosis, care, and services. So Quebec put mainly, they created some programs already, like the PQDNSU and the PAQTMMH at the end. So there's a lot of letters, but it's specific programs to make sure the Quebec reimburse some treatments that are already existent for patients. So and they will create more and more different programs during in the next 4 years, especially in the different conditions that are associated with pre-implantation genetic test, the prenatal screening, neonatal blood and urine screening. So there are a lot of different programs to make sure that people knows about if they have some kind of mutations, and after that they can decide if they want to have the babies and everything. So I think it's great access, and they have to put it forward in a faster manner. So next slide, please. For the third axis, in the action plan, we were especially mentioned in the Access 3.1, which is to create a patient registry across Quebec. So right now at the moment, we know that there are a lot of different patient registries, and Quebec wants to create their own, and that will involve every different rare diseases patient. So it will be a hard task. I think with the money that they put in the total action plan, and sorry, I didn't mention earlier, but it's 17.2 million for 4 years. So it's not that much, and I think they will be in the obligation to put more money just for the patient registry. And after that, they want to create a rare disease network, research network, and all the different highlights that you see there are already in conjunction with the Access 1 to make sure the research field and the clinicians are working together. Next slide. So I will just so thank you for your attention. I will just pass the puck as I can say to Duran for finishing the presentation.
So I think Bill's going to jump in here and talk to us about
sure.
the petitions going forth, right? But I really want to say again, are we okay?
No, yeah, go ahead.
Yeah, I just wanted to thank Jonathan and to point out to everybody, Quebec is there. And what we want to have is similar strategies in every one of the provinces. It's not clear exactly what needs to go into those bilateral agreements. So that gives us some real room for working with the provinces to come back, as we hope Quebec will quickly do, and say, you've got the money, let's unlock the money. So let's put this into not just for drugs, which of course are really important, but into the infrastructure and developing the system. So we see Quebec as actually having a model that we don't have to, it's not a cookie cutter approach, but it really does provide what we want. But to be honest with you, and I think, what we're working on is we've got huge agreement and support from all of the clinics, the provincial networks around the country to really set up this rare disease network, and we can definitely get it started without waiting for the federal dollars to drop, the same as Quebec has proposed here.
Yeah, and thanks, Durhan and Jonathan. And we've got a few questions that have already come in through the chat. One thing I think that we want to make the link to is the 17.2 million for Quebec is almost a down payment on a very aggressive and ambitious action plan that they have in place. Durhan, you're working with Ontario and the other provinces to do what they have started to do in Quebec, and that's really where the health system is run anyway. And we need effective sponges in the provinces in order to actually put that money to good work that is coming from Ottawa and the federal government. And that's what this petition is about. This is a petition that is open for signature on the House of Commons website here in Ottawa. So it's in French and in English, of course, and you can link to it. We're getting closer to 2,000 signatures, which is terrific. And it basically says, get moving on implementing that national strategy, getting the funds to the provinces, which is where the bulk of that money is going, make the funding more indefinite than it is right now. Right now it's 3 years, but of course the provinces would be worried that this would dry up after 3 years. We want to make sure that's ongoing funding and ensure that CORD and the RQMO are key partners in the discussions for implementation, and then build out the strategy to include centers of expertise so that the new funding contributes to better care, because just funding new drugs is not going to necessarily get the better care that we need. So actually, I'll stop sharing right now, because I think we do want to open it up a bit. We've got just a couple of minutes left, and we only budgeted half an hour. This is the first time, I think, that we've presented the Quebec strategy in English. So Jonathan, that's fantastic. We do have a translation of the Quebec strategy as well. So lots of questions online. Are you going to share the slides, etc.? We're going to do more than that. We're going to share the 2015 strategy. We're going to share the Quebec action plan, as well as all the slides. So this is hopefully we've got 160 people on the line right now. There's so much interest with this. We have time for maybe one or two questions that are online. Let's try to keep it really high level. Some are about sequencing, and Durhan, you've already weighed in there. What I think the best question is, what can we do as individuals to help see this implemented? I think that's the best one, because what are we going to do about it to make sure it actually moves forward? So I don't know, Durhan, if you want to tackle that.
Well, I think the petition is a huge point to let the government know we need to get this moving, right? But we are also hoping, and this is where I need hopefully a lot of these 160 people from right across the country, we're going to be going province by province. We want to host roundtables. We want to get you to get engaged with us to bring the provincial healthcare system, the provincial researchers, clinicians to the table to help talk about, why is this valuable to you in your province and how can it be set up? I mean, as you've seen, the Quebec strategy has some dollars attached to it, but I think Jonathan said it clearly, it's not going to cover everything. And what we need to do is to be able to show the provinces, though, that there is money on the table. Now, let's make sure that you're stepping up to spin it wisely. It would be amazing if we could get enough groundswell to actually force this topic to the ministers, to the first ministers table when they meet later this summer. I know it's not yet on the agenda, but if they hear from everybody, we can force it on the agenda.
Just to build on that, Durhan, so in mid-July, the premiers of all the provinces are going to be meeting in Winnipeg. So that's July 10th to 12th. So we've got just over a month now to say, hey, come together to say that the provinces support and want to see this funding flow, and that they're going to put the money to work to actually help patients and stand up these strategies across the country. Maybe Jonathan, just one quick question for you. With Quebec's share of that funding potentially coming from Ottawa, what would that mean for the Quebec action plan in terms of actually being able to implement that over the next 4 years?
Yeah, of course, it will be really helpful. Like I said, it's only, well, it's better than zero still, but it's only 17.2 million for 4 years. And so if you divide it by 4 years, it means 4.5 million. And we know that the Quebec budget for health in general is 53 billion. So like it's really like a small small portion of the budget that they put on rare disease, but still it's better than zero. So okay, so it's a big step. But I guess I really asked the provincial government, especially Quebec one, to really make sure they can have the money as fast as they can to implement all those actions. Like I said, since the announcement of the federal announcement on March 22nd and of the action plan on May 1st, nothing has been going on right now. So we are still waiting. We know that the summer is by our doors right now, but I guess in the fall session, we will be working hard to make sure they can they can have the money as fast as they can, because right now patients are waiting at the moment, and patients are dying. Like it's the sad reality right now. And so yeah.
Yeah. So just thanks to everybody. I know we're running out of time. I really love what I see is there's a lot of new people coming on who says, what can I do to help? So we're going to capture all this. We're going to put out some real calls for help. I mean, Quebec has given us a good blueprint. They've provided, so the government has stepped up and said, we want to do this. But as Jonathan says, the money, of course, is not going to help them achieve those ambitions. We need the federal dollars in there. I will say, at the risk of not of opening up a different firestorm, we are going to be pushing for public-private partnerships in terms of helping to execute on this. We need to put public-private partners in stimulating research. We need to make sure that we're getting the private investments in terms of clinical trials, and we already have those projects that are ongoing. So we need to, really leverage those. But we also need to support into some of the fundamental services that we're talking about. We've seen how that worked well in terms of newborn screening, how support for setting up the programs have led to the coverage of it. So these are the kinds of innovative initiatives that we're going to be looking for, but we do need everybody's support. I love this. And as we're rolling this out, we really are going to be, looking for people to get engaged and to get involved at that very grassroots level. So I think Bill, Jonathan, we should close it off here, because but if you want to hear this again in French, you can come back at 1 o'clock. I don't know if everybody's got the French link, but we will provide the translation of the action plan in English to everybody. So all this will be available on our website as well. And we will have definite links to RQMO, so that we will now see sort of much more sharing of resources across our websites as well. So thanks again to everybody.
And thanks. We'll see you in person or on the next webinar. And merci, Jonathan. And we'll see you both in 25 more minutes en français. Thanks very much.
Yeah. Thank you. Thank you to everyone.
Bye-bye.